So the first skill that I'm going to perform is the demonstration of an IV push or IV bolus medication through a non-running or INT intravenous line. This is a peripheral line. Later in the other video segments, we are going to discuss the administration of an IV push medication through a central venous access line, but for now we're going to focus on the peripheral. So the first thing that we would do is our 6 rights of medication administration. We would also make sure that the medication that we're going to administer does not interact with any of the medications the patient is on, and of course the patient allergies. So we have done all of those things, and we're going to move on to preparing for the administration of the medication. The medication example that I have today is IV Furosemide or Lasix. We know that furosemide is a loop diuretic. So when we think of the action of that medication, we can think that this is going to help to get rid of fluid from the patient's body. So what are some things that we're going to check before we give this medication? Well, the first is, of course, our potassium level. We're also going to check the patient's blood pressure, and we really should be looking at daily weight and fluid intake and output, because our action of the medication is going to give us a desired outcome of fluid loss. So we want to make sure that that patient has equal balance. So the other thing that I have done is look in my Davis drug guide, and I've gone right to furosemide, and there I can find under the IV administration is IV push guidelines to help us in preparation for this. The big things that are important when we are going to administer a medication via IV push is to understand how fast this medication should be given and if it needs to be diluted. Most medications are no longer diluted, IV furosemide being one of them. And it also says here that our rate of administration will be at a rate of 20 milligrams per minute. For the basis of this video, I am not going to administer that over 1 minute, but keep in mind when you're in clinical, those are going to be some of the questions that your clinical instructors ask you. How fast are you going to push these medications? And why is that important? It's important because these medications are fast acting and they're going into the circulation extremely quick. So it's important that we know how fast to push it so we can eliminate potential complications. So I'm going to prepare, I'm going to use my hand sanitizer or soap and water. And for the administration of this medication, we would don gloves. So I'm going to put those on. I have already drawn up my medication. Here we have our furosemide, and we are going to give 20 milligrams. And if you remember right from the text here, it tells us that we're going to give 20 milligrams in a minute. Supplies that we will need an IV flush of normal saline before, and you can see that I'm going to get the air bubble out. For peripheral IV flushing, we're going to give 2 to 3 milliliters. And I have my medication, and I have an IV flush for thereafter. So it's important you have all of your supplies ready and prepared when you're going to give an IV bolus medication. I also have plenty of alcohol swabs as well. So we'll come to the patient here. I've done all of my 6 rights. I have verified that this patient does not have an allergy. And we are going to come to the IV site here. You can see there's a green cap. That green cap is a chlorhexidine cap, and you're going to see these utilized at many facilities. Maine General also utilizes these. When there's a green cap on the end of that port, you do not need to cleanse with an alcohol swab. That is per Maine General policy. So we're going to remove that green cap, and we're going to flush with 2 to 3 mLs of normal saline. Now, prior to the administration of this saline, I'm going to assess for blood return by pulling back slightly. I see blood return and I'm going to administer. Remember that oftentimes with peripheral lines, you may not see blood return, especially if the catheter is small. In between each syringe, I am going to cleanse with an alcohol swab for 15 seconds. Here is my medication, and as defined earlier, we would give this medication over 1 minute. For the purpose of this video, I'm going to push it a little bit faster. As we push the medication, you may find some nurses pulse to administer the medication, or you might find that some nurses give a small amount, stop, time it, and then administer another small amount. You should have a watch for this, and in clinical you should be prepared and have a watch and be watching that administration of the IV push medication. For the purpose of the video, I'm going to go a little bit quicker. I've disconnected that syringe and I'm cleaning for an additional 15 seconds. Now, the final saline flush is going to be administered at the same time or rate of administration as the medication. So, again, this would match the medication administration time. So the medication was over 1 minute. This will subsequently be over 1 minute. The thought behind that 1 minute is the dead space that you can see between the catheter line and the tubing. That's where the medication sits. So to give this flush very fast would mean that the medication is going into the systemic circulation extremely fast, which can cause some potential complications. And that is complete. And at the end, you would place a new chlorhexidine cap on, and that is the completion of the IV push through the peripheral line.